Good afternoon, everyone. Today we will analyze one interesting clinical case from my practice. A patient with a frontal group of teeth turned to us. Her aesthetics do not satisfy her, the absence of a front tooth, and of course we decided to go along the implantation path. But unfortunately the patient had limited time and budget, and we decided to cover the frontal group of teeth with ceramic crown, and on the chewing section to make a partially removable prosthesis. We started the stage of preparing teeth, preparation of teeth by endodontic method. Because the volume of the prepared tissues was very large, we prepared the teeth, removed the abrasions with silicone, and in the future we fixed the ceramic crown. On the chewing section we made a partially removable prosthesis made of acrylic plastic. The patient was very satisfied with the aesthetic result. We liked this work. It was aesthetically pleasing, it was beautiful, and most importantly, this work meets the functional requirements of the patient. Later we learned that the missing tooth was previously implanted, and after the removal of the implant, its instability after the implant was installed. It was removed and the patient walked without a tooth for a long time. In this work we used the pre-tau ceramic crown. This shows its aesthetics and shows a great result. Harmonious work. In this slide we have a photo with retractor to show the entire cavity of the mouth. Here we have a Disney retraction with special thread. After the preparation, the threads allow us to make a good quality imprint and see the concave space, and the technique in the future has no difficulty. Create a ceramic crown, a metal crown that fits perfectly on the tooth. And here we have the result immediately after fixing the crowns and the partially removable prosthesis. As you can see, the crown is slightly hyperemia due to the cleaning of the cement in the crown area, but the construction and elements of the prosthesis are completely invisible, and they correspond to the aesthetic parameters of the patient. Even with a wide smile, we do not see the difference between the prosthesis and our teeth. The patient is very pleased with the result, and we are also happy with the work done because it really transforms our patient and creates beautiful results. Thank you all for your attention. All the best.